We're live. So if you all can introduce, thank you. First of all, thank you for being here today. We appreciate coming and spending time with us, giving our readers an opportunity to hear about what you all do. So if you can introduce yourselves, then we can start the conversation.
Great. Well, thank you for having us. I'm Karen DuBois-Walton. I'm the Executive Director of Elm City Communities, which is what's known as the Housing Authority in the City of New Haven.
Okay.
Joined by...
I'm LaToya McCrae, Director of Community Economic and Development.
Okay.
I'm Carol Suber, Elderly Services Consultant.
Okay, great. So, Ms. Karen, if you can tell us a little bit about what the Housing Authority does,
Sure.
Elm City Communities, and then we can go from there.
Great. So we are a provider of affordable housing in the City of New Haven. And with that, we develop housing, so we are involved in redeveloping our own communities and also building new affordable housing in the city. And we provide a whole host of supportive services for our residents. Our goal really is to help move families out of poverty. And we see our role as ending poverty for families, one family at a time, through providing housing that they can afford, and in reducing the housing burden, the amount of their income they're spending on housing. It allows us to use housing as a platform to help them with a number of other things. So the services that LaToya and her staff are involved in are really crucial for helping meet families where they are and provide the kind of services that are necessary to help them move forward. And our goal is to give families more housing choices so that as they have more income and more options, that they can potentially move out of subsidized housing, enabling us to house another family. At any given time on the public housing side, we're serving about 2,500 families and about 3,500 families on the Housing Choice Voucher, which people often call the Section 8 program. We have about 10,000 families on the combined wait list. So we are really invested in this, both for the well-being of the families we're serving, but also for our opportunity to be able to move them on so that we can house one of those other families that have been waiting, for most cases, waiting years for housing. So using housing, so we are manager housing, so we do everything that a typical landlord would do. So we're responding to work orders, and we're screening residents and selecting residents from our wait list and managing all those functions. We're housing them, and in housing that is our traditional public housing portfolio, but also in housing that we have redeveloped and build new communities as well.
Okay.
And any of our residents can take advantage of the supportive services that we offer. And that's from our youngest children in our developments through our working adults. We also serve disabled adults and disabled families and our elderly. And so the services that are provided are different based upon what families need. So our families raising children have a lot of things that are focused on early childhood, on school-age children, providing appropriate supports to families as they're raising their children. For our disabled residents, it's more about providing services so that they can be housed comfortably, remain housed, meeting their needs there. And for our elderly, where this is most likely going to be their last housing stop, we want to make sure that we're providing services that help them have the highest quality of life, accessing services that they need, accessing things that can allow them to remain in their housing for as long as possible. So we talk about helping families age in place by providing access to healthcare services, to meet food insecurity needs, so food banks. Sometimes it's about transportation, helping people get to things that they need to get to, and providing services right on site, as well as linkages to things that are happening in the community. That's some of the work that LaToya does, and one of the reasons that we brought on Ms. Suber as our consultant in this area was really based upon her knowledge of what's provided in this community, things that our residents maybe hadn't been taking advantage of up until that point, and making sure that anyone who's living in one of our properties has full access to the services that are throughout the city. An important thing that they've been working on is a health fair that will happen hosted right on one of our properties, 122 Wilmot Road. And that will be on Thursday, April 20th. Okay. It's a health fair for all of our residents, and we'll be offering services and connections to services that will be important for our families in terms of their health needs. Good. But I'll let them also speak a little more detail about some of the supportive services that are offered.
Okay, so going to that event on April 20th, it begins at 10 a.m. We have around 20 vendors, ranging from agency on aging to Yale. We're going to be providing mammograms. We're going to be providing hearing testing. It's a variety of things. We're going to have some raffles. Each vendor will bring in a raffle for the residents.
Okay.
And this is just a way that the residents can know more about the programs that are offered in the community. At each development, we do provide transportation to the grocery stores, and we look to expand that. We are partnered with Mary Wade, so Mary Wade comes in and helps us.
Okay, good.
We provide food banks. We provide assessments. We do personal goals, personal assessments. It's an array of programs that we provide to increase the quality of life. And we also link them up to make sure they're okay with their doctor's appointments, and we linked up with the doctors and et cetera.
Okay.
For every family, when they move in,
Yes.
A member of Latoya staff will go and meet them. So they've met
Yes.
every family as they move in, and they meet with them and really identify what are the needs for that family, for every member of the family, and develop a plan of things that we can be working toward together. So they will identify any needs. Some of our elderly residents maybe have a dream they never completed their high school education and they want to be in our GED program, and she helps them. She and her staff help link them to those kinds of services. For others, it might be a health related. There's some medical needs that need to be addressed. Some might be a behavioral health need, getting them connected to case management services and that kind of a thing. Some of our elderly are raising grandchildren, and so they might discover a need for some support around that as well. But whatever the needs are, they help put together a plan of what is it that we offer, what is it that we can link them to in the community, and help them to meet those goals that they identify for themselves.
How many elderly folks do you have in your development?
So about half our profile, I think you actually have the
I
exact
actually
numbers,
have,
but
it's around 762.
Okay.
Yes.
Okay.
Yeah.
And
about
these are
half
ages,
our portfolio
ages
is
of
elderly and disabled.
65 and older, or 55 and older?
It's elderly disabled.
Elderly disabled.
Yes, and actually we have a little bit more because some of them are in the family developments, but we have elderly disabled combined housing, 760.
There are some developments that are only for our elderly residents. They have a designation that are just for elderly, and the adult member of the household needs to be elderly. They could have others in their household as well, and that's typically defined at 60 and older, 62 and older. But if we were ever short on that, we can take what we call near elderly into those developments as well, and that's appropriate for people who prefer to live in a community where it's all going to be seniors. And each of those developments, residents have their apartment. There's typically some community space. In the community space, there's programming that's offered that really varies based upon what the residents like. Some of our developments are for both elderly and disabled residents, and so disability could be a physical disability, it could be a behavioral health related disability, and in those buildings, the mix of elderly and disabled also is supported by on-site case management services and supportive services to help residents maintain their housing there. Community rooms with active programming happening out of the community room as well. And each building is supported by members of the Community and Economic Development team. Sue, do you want to talk about?
Yes, in our elderly services and disabled seniors, and as I am one of them, I can honestly say, and I have been doing elderly services work for many, many years in New Haven, we have the largest elderly servicing senior buildings in New Haven. You know, there's a lot of senior buildings. And when you look at them, for instance, George Crawford, who I personally knew, lived on Orchard and Dickerman, to see what we're doing now with elderly and our seniors is because they're living longer. No one knows what do you do when you have a 65 to a 95? So you may have that in any of our developments. But the idea is to talk to them, and that's where I come in this other staffing. And I say that respectfully because a lot of times we ignore our elderly. Do you ever call up someone? When's the last time you seen them? You know, things like that are important. You don't want to, I didn't see her for a week in my apartment when something's wrong. So you're building relationships because many of them don't know each other. And the idea of the health wellness fair really came out of them saying we don't know each other. So we're bringing all of them together so they know each other, but also know the services. They're very, very scared with what may be going on in Washington. They don't know Medicare, Medicaid, all those things are important to them, certainly Social Security, you know. And I can honestly say that many of them, once they see that someone cares and each other's development, they have staffing is in the buildings, for instance, and I suggest that the register and everyone else, at some point in time, come visit these buildings, because they're really important to know. Our seniors in New Haven, especially those who live in the housing authority, have grown. They see things. They see people now doing more with them. They're beautiful community rooms. They got kitchens in there. They have a lot of things like computer rooms and different things like that to keep them going. And now they're forming clubs. They're playing cards and different things that keeps their mind going, because this is what happens sometimes when you get into Alzheimer's and dementia, is you're not focusing. Well, as long as they're reading, they're starting reading clubs, that's an important ingredient for anybody who's elderly and senior. And no, they can't get out. We had a blizzard last week, you know, actually most of the week they did. But the staffing was there, looking for their needs, anything, make sure they're warm, but also to look at their quality of life. And it's really expanded tremendously. So I can honestly say that the Housing Authority has moved in the direction of caring for all families, but the seniors and elderly, who are our largest one of our largest population, is on the ground.
Yeah, that's a good question. So when there's inclement weather like that and you have folks in your development, so how do you all, if emergency comes up, you know, how do you all handle that? If someone has to go to the hospital, are they on their own? You know, how does that work?
So we really see ourselves in partnership with our residents, so we hope nobody really feels on their own, that there's always someone they can call. But we have staff that work, so just as city staff are out plowing the city streets, our staff is out clearing our sites to make them accessible so that people can get in and out. You know, some of our residents had to get to jobs, some of our residents had to get health care in, Meals on Wheels in, that kind of thing. So we're making sure that our sites are safe, clear of snow and ice, so we've got staff that are doing that. And then Latoya staff is really paying attention to the people end of things. So what do people need while they're snowed in? You know, we've had times of extended snow periods, not so much this winter, but last winter I can remember times where schools were closed for multiple days, and people sometimes lose sight of the fact that some of our families depend on schools being open to be able to feed their kids breakfast and lunch. So that became a need, and something that Latoya staff worked on was how could we bring meals to our residents to help fill some of that gap. Pay particular attention to elderly and disabled whose visitors may not be able to get to them, or their health care could be disrupted because of that. So staff really checks on people, and so even in the snowstorms, we're open and we're working to meet people's needs.
So with the elderly, how do they, I guess, like, how do they, you know, pay for their living? Is it through Social Security mostly? Is it through, you know, family members helping? You know, how do they?
So one thing all our families have in common is they're with us because at the time they came in, they were meeting the low-income thresholds, and so we know all of our families have that limited income as one of the things that they're dealing with in terms of their lives. Our rents are set based upon 30% of your income.
Okay.
So the exact percentage would be 28.5% of anyone's income is going toward their housing and utility expenses.
Okay.
So that means you and I could be living in apartments identical next door to each other and paying a very different rent based upon what our income is. And some people literally have no income, and so they're set at a minimum rent and can even be exempted from paying anything during that period of no income. A lot of our seniors are on a fixed income that's a Social Security disability, so their rent would be 28.5% of what they're getting each month on that. And that covers their rent and utilities as well.
Oh, wow. Okay.
Yeah,
I didn't know that. So what about veterans? Do y'all have any veterans in your buildings?
Yeah, we certainly do.
Okay.
We do.
Is there any special attention that they get with?
So the federal government does have a program for supportive housing for veterans, which offers them, and it's a partnership between housing authorities and Veterans Administration.
Okay,
So
gotcha.
we're partnered with the West Haven VA,
Okay.
and we have a number of Housing Choice vouchers, Section 8 vouchers that are designated for veterans and their families. We administer about 85 of those each year. And the Veterans Administration provides supportive, so they actually screen people and send us the referrals. And then they provide ongoing supportive services and case management for the families to help them with any needs they may have. And we provide the housing assistance. So that's a special set-aside program that the
That's
federal
good.
government has. Beyond that, though, just throughout our public housing portfolio, there are veterans who have applied off of our wait list, as usual. It is important to note, because housing is of such demand, lots of our wait lists are closed and people cannot apply, but our elderly and disabled wait lists, and our wait lists for families who need a wheelchair accessible units are always open. So if there are families out there who are in need of housing for somebody who meets any of those criteria, there is an opportunity to apply. Applying doesn't mean you get housed the next day. There is still a wait, but it's typically a family may expect to wait at least 6 months, probably a year for housing once they've applied and moved to the top of the time from applying to move to the top of the wait list is usually going to be about a year.
So it's closed because nobody's moving out?
It's closed because the number of families that move out each year compared to the number of families that are already on that wait list it's so small it doesn't make sense to keep adding families to the end of wait list. So if you're like looking for a 3-bedroom apartment, it's often a family raising children. There are thousands of families on that wait list already. So it gets closed at that point. We update the wait list. We try to make contact with all the families and find out, do you still need housing, and clean up the wait list in that way. But it just moves very slowly in terms of the housing is just such an affordable housing is such a need that when families get it, on average they stay with us a good 12 years before moving on. So
there's no time frame that folks can have to leave, or they could stay as long as they want?
So on the voucher program, the families will continue to get subsidized until their income reaches a level where they exceed the poverty income. So
that's what the
we do a lot of work to we do a lot of work to help families, particularly our work-able families, build their skills, get matched to jobs that are higher paying with better benefits so that they have more housing options. And when they reach a level where they no longer meet the criteria, then we wouldn't subsidize them anymore. They technically hold their voucher for a period of time just because things happen. You get a job, you could get laid off 2 months later, but we're not sort of paying on that voucher. And then if they've been for 6 months at that level where they're sustaining their income, then that voucher can go to another family. They no longer need it. On the public housing side, they have to be income eligible to come into the program, but their income could rise, and it doesn't jeopardize their keeping their housing. We try to work with families so that when we see a family, hey, you'll start paying more and more rent. When we see a family that's paying what we consider a market type rent, living in public housing, stable employment, we're really trying to incentivize them and help them think about their other choices. You know, you could live anywhere at this point. You could buy a house, you could rent in the private market, and try to help them see their options and move that plan so they can move on. We are piloting, though, because as I said, families do stay a long period of time and there's a huge wait list. We need to keep thinking about ways to help families move. So we are piloting in a couple of our locations a term limit that has people accepting subsidy for no more than 7 years. And with that, they get intensive supportive services to really help them work their life plan to get to where they want to be. And at the end of that 7 years, they get what's a cash amount that's the equivalent of a year of their subsidy. So a family could leave with $7,000, $10,000 at the end of that time. They're agreeing they're only going to be subsidized for 7 years, taking advantage. And so we've had some that have finished college during that period. We have a couple that have bought homes and moved on. One, I think, is in law school at this point. So we have families that are really taking advantage of that support, recognizing this is a time limit that I need to do the most I can in that period, and getting that financial help because people need some assistance to be able to sort of launch to the next level, and so that's something we're piloting.
So is the city or your department looking to maybe expand and develop more buildings, in the near future, so more folks can, have housing, in the city?
So that is our hope. That is absolutely our hope. So we are actively redeveloping all of the old public housing that we had, and we're tearing down and building new communities that work better for families. And some of those include elderly-only properties, but some of our elderly say, that's not the kind of community I want to live in. I want to live in a community where there are kids around and more intergenerational, and so we're building communities like that as well, where there's apartments that are appropriate for maybe a 1 or 2 bedroom for a senior family, also in a community where there are 2, 3, and 4 bedroom communities. So we're really intentionally rebuilding all of our stuff to be quality housing of choice for families that's affordable right now. But we know just replacing the housing that we have is not making a dent in that wait list. It's replacing existing units. And so we are also looking for opportunities to partner or on our own develop other housing. There's not new federal money coming to develop new public housing, so we look to be very creative around what are the other tools we can use out there to develop. But we certainly know that there is greater need than any entity is providing right now in New Haven. And we're also engaged in regional and state level discussions, because we also know that all of the affordable housing can't sit just in the big cities. So this can't be a problem that New Haven, Bridgeport, Hartford, Waterbury, and Stamford solve by themselves.
Right.
And we need to be in those kinds of conversations with our partners throughout the region around what will it take for a North Haven to develop affordable housing that is near jobs, that families can get to. A lot of our families depend on public transportation, so it doesn't make sense to build something somewhere where people just can't get there. They won't see that as an option, a real option for them. But that's going to be important. It's important, I think, discussions for the state around the distribution of affordable housing. It has implications around how do we desegregate the state, and in terms of achievement gap and education conversations. I think it's an important conversation to continue.
Is that a big challenge to try to have other towns that normally don't have public housing to now look at, possibly having public housing in their towns? Is that a challenge?
It has been.
Okay.
It absolutely has been, which I think you see played out. Right? There are 169 towns in the state of Connecticut, and the bulk of affordable housing rests in the larger cities that I've named. So I think it's an important, challenging question to continue to pose. Both how do families feel like those are options and want to move into those areas, and what do towns do to be responsive to that need, I think, are both sides of the question, and some things that the state legislature will be paying some attention to, as well as federal policy will have some impact around, what does the federal government do around this area?
Yeah, that'll be very helpful, particularly with the larger cities not having enough space to, house develop more properties so folks can come in and live in those properties. So what about pets? Are pets allowed in your properties?
Yes.
Okay.
Pets are allowed. Pets are allowed, yes. Okay. People let us know if they have an interest in having a pet. They pay a pet deposit, which just covers if there's any damage to the unit. It's fully refundable to them when they move out if their pet has not damaged the unit. And it is for traditional domesticated kind of animals. So we're not a place you bring your chickens. But you certainly could have a small family dog, as long as it's well socialized and not a threat to the community.
Good. So what about your smoke-free development? I know I was talking to someone.
Smoke-free, yes.
So what's
So
going on with
the
that?
Obama administration actually moved forward the smoke-free guidance and established now federal regulation around smoke-free housing. So the public housing has about 18 months, we're a few months into it now, so I guess we probably have about 16 months to go completely smoke-free. Here in New Haven, the first public housing property to go smoke-free was Monterey Place, which is the old Elm Haven on Dixwell, and so they are 100% smoke-free. They were followed by Quinnipiac Terrace and our new Row building, which is on Sylvan and Ward, which are now 100% smoke-free as well.
Okay, good.
So we do have some developments that have already taken that step. We've done some surveying. We know that we do have a good number of tobacco users, smokers, particularly in our high-rise buildings, our elderly and disabled buildings. So we want to partner that new policy also with some assistance for people. So we're looking to roll out some smoking cessation programs that will help people be able to move away from tobacco at the same time that we're moving the buildings to being smoke-free. There certainly are health implications for both helping the smoker go smoke-free and also the others who are subject to the secondhand smoke. So it's been an important initiative that the federal government picked up, but it's also something that the local city has been on the forefront around. So the city passed a smoke-free ordinance a couple years ago at this point that designated areas. I know the city parks, a lot of public areas are now smoke-free, and we've been at the table with some of that. So that more to come on that as we continue to roll out our local policy around it.
How has the HUD been affected by the new administration? Have you seen any changes with that as of yet?
Well, so we have, with new president comes a new Secretary of Housing and Urban Development. So he was recently sworn in and has taken office. Too soon to yet see what his new policies are. The proposed president's budget certainly caused concern for families who are living below the poverty level. Concern for the funding. So we're not anticipating new dollars into the public housing program, which is a challenge as a landlord to operate the properties, to keep up with particularly older housing stock without getting the kind of capital money that we need. That creates challenges. So we know we're not seeing any new significant infusion of funding there, but we haven't seen any particular policy change yet. I think it's still pretty new, and we'll need to see what comes out around that. But we are not a city department. We are a standalone entity. The vast majority of our funding comes from the federal government, so we are very much subject to what happens at the congressional level, and with presidential, much more so than what happens at the state or local level. Our money is really the rent that people pay and the federal subsidy we receive. Those are our funding sources. So the harder it becomes for people to make ends meet, we see that on the rent payment end, and the tighter the federal budget is, we see that on our subsidy end.
What are seniors saying? What are their concerns with the new administration, particularly with all the social programs that look to be cut? What are the seniors saying?
It's in between, as Dr. Karen Walton has alluded to. They're not sure.
Okay.
They're listening, they're watching, they do have concerns. Most of the concerns that I've heard from the buildings that we do service is my Social Security going to be, cut? If my Medicare, Medicaid, how's the subsidy going to change? Connecticut has a different type of subsidy with Medicaid than other states do. Do I qualify for that under DSS? So a lot of those questions are still up in the air. We're hoping, but one of the things I hope that comes out of a lot of this is community forum on what's going on with elderly and seniors, and as we age. It's called aging. And as you age, the strategies, what is the formula for it? What's going to happen? But let's not wait too late to discuss it. Let's discuss it early on. I was just at Southern Connecticut 2 weeks ago dealing with aging on strategies, dealing with that. And it was very interesting to listen to, as you just alluded to, the towns. Their perspective of towns and who they serve is a little different from us. But it's important that we are all in this together, whether we like it or not, or we see it. And it's important to know that if you don't stay on top of what's going on in your congressional level, you're going to be lost. So the seniors are saying, and the elderly and disabled, I don't want to lose anything. I ain't got much now. I need to hold on to what I have. And so we keep saying to them, we're going to be right there. We're going to keep you informed as best we know, but you still to keep invest, write someone if you get letters. Lately, I would say that our two senators, the senior and junior, and our district congresswoman has actually been sending us letters. I got something last week. So a lot of times I bring that out. Did you get this? Did you fill it out? Did you send it back? Because those things are important. Excuse my voice. AAA is doing a lot. I can honestly, they're sending out a lot of information. AARP is sending out a lot of information to the seniors, whether they're subscribed to them or not, to inform them, because this is important. They look at their subsidy, they look at their supplements, they need to know, and they can't wait the last minute. So the uncertainty of a lot of this is what they're concerned about.
The seniors we're housing really depend on public housing authorities being strong. They depend on their health care. So for most of our folks, it's Medicaid and Medicare. So changes to affordable health care are certainly important. They depend on things like Meals on Wheels, those kinds of services as well. So cuts in any of that sort of social service net certainly have a significant impact on our population because they're living in poverty. And so we it's forced us to go beyond just housing advocacy, but really to be thoughtful with how do we keep our people aware of what's happening and strong advocates for things that are happening. And so that's one of the things that the work of Ms. Suber. We also have an organizer that we have on staff who works more with our parents who are raising school-age children, but to help them have the tools to be effective advocates, which could be advocating to us around a policy, or could be advocating for something that's more local, state, or federal kind of policy.
So, does the staff, do you at times didn't talk with the Connecticut congressional delegation about
absolutely.
What's going on and how important it is, a need for for elderly and other folks to have these housing, and what have these
Absolutely. So we have a very supportive delegation.
Okay.
I mean, Senators Blumenthal and Murphy and Representative DeLauro understand our issues. Our properties they're not strangers to our properties. They come, people know them. They understand the needs of Connecticut very well. And, as I talk to, we have lots of industry groups that bring together public housing authority directors across the country, and not everybody enjoys that sort of relationship where their delegation really gets them and their needs and can be supportive. So that's been very important to us. I think their challenges they're working, our entire delegation for New Haven is Democratic, and they're working as a minority in both the House and the Senate right now, and so a lot of what they want to move is challenging, but they certainly understand our needs and certainly have been tremendous spokespeople for the residents that we serve and for residents throughout the state.
So do y'all do any type of transportation with the elderly? Like if they need to go to the grocery store and some of your developments, so how does that work?
Well, we do have a Elm City Communities van and bus.
Okay. Oh, good. Okay.
And we do partnership with like Mary Wade, like I said before. Also, we have Continuum in some of our buildings, and they also provide transportation to the grocery store. So yes, we do provide transportation to the grocery store or Super Walmart.
Now, is that federally funded too, or that they're on their own, or is there a discount, or?
There's no specific funding stream that we receive for that, but it's the way in which we locally have decided these are some of the needs of our residents, and so we are using some of our funding to support that kind of a thing. And then we're also, though, in great partnership with the city's traffic and transportation department, and engage Connecticut Transit and DOT around conversations, because sometimes it's not something that we're going to solve, but it's something that a change in the system could solve. And I'll give you two examples of that. One that it was resolved successfully, and one that we're in the midst of. But One of the reasons that we really advocated very strongly in the West Rock community for removing the fence that used to exist between the town of Hampden and the city.
That was a big thing.
Absolutely, a big thing with a successful resolution. And the beginnings of a real feeling of a community around there that's not broken by a fence. But transportation was a big issue there. Our residents could see the bus that was, a few feet away from them but couldn't get to it, and instead had to take circuitous bus routes that brought them all down into New Haven just to get to maybe the closest shopping might have been in Hampden. So Connecticut Transit really worked with us around that. We've been able to expand routes now that road is open to reach our residents out there, and that's the kind of thing we work toward. We're in the midst of something right now where we hope Connecticut Transit will also be responsive, where we have residents in one of our senior-only buildings who are advocating very strongly and effectively on their behalf, have engaged their local alders, engaged the city around trying to get a bus stop moved right on their street. They're on Sherman Parkway, whereas right now they have to walk the equivalent of about 4 blocks, probably, up to Dixwell. And these are folks, this is a community that's very heavily relying on use of wheelchairs and walkers, and it is a senior-only building, so they are aging, and that's quite a block, and the sidewalks aren't always available, and you actually see folks in wheelchairs in the middle of the street trying to get to the nearest bus. So sometimes our role is to try to advocate for others who can make a change in something, and we're hoping to get a bus route change that will really facilitate their being able to get around to doctor's appointments, shopping, that kind of thing.
Well, what about youth programs? I know in the past we have written stories about straightened programs that involve the youth at some of your development. So can you tell a little bit about some of the programs?
Yeah, we have a lot of youth programs. We have Youth at Work.
Okay,
We do that. We have a program called the STEP program.
Okay.
And we are providing employment to around 50 youth.
Okay. Where the youth come there and help work at the development, some of the developments?
Yes, some of the developments, and we're mentoring them. So we're helping with resumes, we're prepping them with work, just learning work ethics.
Youth at Work, the young people might be assigned to a job anywhere in the city, so different employers are employing our kids through the Youth at Work. And then in the STEP program, they're assigned somewhere in the housing authority. So we have young people who say, I think I might want to be an accountant. And they've been placed in our finance area, working with accountants there. They get that stipend, which is important. They're getting a paycheck. We're encouraging them to save some of that money. But importantly, they're getting that mentoring. They're getting to sort of feel what it's like to be in a workplace. They're seeing, I thought I was an accountant. I might want to be an accountant. Well, this is what an accountant does all day, and sort of learning that, talking to it. And then they get all this soft stuff, too, that goes along with it. So in that relationship, in that forming of a relationship, they get a caring adult who's helped them with all sorts of things, writing letters of recommendation, helping them with college applications. When college acceptances came in, we've had students who sat with their mentor and sort of went through, here's my financial aid package, and I don't think I can do this, and help them sort of negotiate that and make calls to the financial aid office, figure out how that might work. So those things have been really important about that relationship as well.
We also have teacher in residence, where we have a teacher that lives on site in the community, provide homework help to some of the residents. Some of the youth, actually. We have computer labs where we help them go online and do with their homework. We have summer camps. We help them coordinate with them with summer camps. The
goal is anything that we would provide for our kids, how do we remove the barriers so that our kids that are growing up in Elm City Communities can access that as well. Sometimes the barrier is money. And so how can we fund some things? We've got Boys and Girls Club on site in a couple of our sites. Solar Youth. Sometimes the barrier is not so much money, but it's the transportation, or sometimes it's the information, just knowing that it's out there. So we're trying to bridge a lot of that with our kids. And again, it's all around the idea of ending poverty. We think the best way to break a cycle of poverty in a family is for the kids that are growing up with us to graduate high school ready for the next level. And if they're ready, whether that's for a good paying job, ready for college, ready for the military. If they can do that and make an income that sustains them, then they don't need to apply to be on the wait list or try to inherit the unit that they've grown up in down the road. So we see it again as a way of breaking cycles of poverty. Invest in those young kids. And make sure that they have everything, the parents and the children have everything they need to really launch them
That's great.
effectively.
That's it. That's all I have. Anything else?
And did we miss anything?
Yeah, did you miss anything? So what's your staff like? I mean, not like personnel, but is it 200 people on your staff? You know,
We're a little shy of 150
Okay.
staff,
Okay.
and some of those are direct line working on maintenance functions, property management functions. So we've got the staff of maintenance workers that are fixing things in developments, getting units ready, that kind of thing. We have staff who are going to be the staff who call you in off the wait list, interview you, certify, check your income, verify income, that kind of staff. We have the staff that's under Latoya that's dealing with all the people needs, everything that comes up, helping you with your life plan and barriers and removing barriers and linking you to services and that kind of a thing. We have a staff that works for the Housing Choice Voucher Program, the Section 8 program. They're doing a lot of interface with landlords out in the private market as well as with the residents. And then just as a big organization, we have all the backbone functions. So we have finance, IT, HR, and personnel functions. And that kind of
that
thing.
must be an arduous task to, have someone to review a person's income like every day to see if they're, qualified for that program or that voucher. I mean, that must be.
So like a lot of federal programs, there's a lot of bureaucracy.
Yeah.
And one of the things we should mention, we have a designation that's called the moving to work status. And right now we're one of 39 of the 3,000 housing authorities that have that particular status, which has been important. It gives us flexibility. We're able to sort of test things at the local level and say, this may not work everywhere, but we think in New Haven this is the way to get something done best. And so out of that, we've been able to do something that really simplifies the process for how do you figure out what people's income is, how do you figure out what their rent should be. For a lot of our families, the income is not changing significantly year to year, but we used to make them come in with their briefcase full of papers, documents showing all this, at the end of the hour interview and 3 hours of staff time outside of that, only to figure out, well, your rent stays the same. So we figured out a much simpler method for doing that. If you're one of our work-able families, you only come in every 2 years to see us. Our seniors, whose income changes even less frequently than that, they only come in every 3 years now. And the whole paperwork that what we're looking for is much simpler. So
Now, is that move to work? Is that the 7-year program you're talking about?
we've been able to do that 7-year program because we're a moving to work agency.
Okay.
But moving to work is just this whole concept of being a demonstration site for trying out different things that might create more affordable housing. So a lot of our development has happened because of moving to work. Our ability to tear down and rebuild as much housing as we're able to do. A lot of our self-sufficiency programs, the resident services programs, are funded because we're able to be more creative at the local level.
How my last question, are folks receptive to that 7-year program?
So when they accept that housing, they're accepting it with that understanding.
Okay,
So if
okay,
they weren't,
okay.
then they would choose to live somewhere else. So there's that piece. But that said, there for some families will be a lot of anxiety as that clock is ticking, and maybe they don't feel like. Because even families that are making great progress, if the job market isn't there to have someplace to land, that's going to raise some anxiety. Like, I'm doing what I took my college courses, I got there, but I'm applying and I'm not getting, or there's nothing for me to apply for. That creates some. So there are some opportunities for families to request an extension or that kind of thing.
So families
those
choose
kinds of situations, but they have chosen to be in that program for us to test out and see. Yeah.
Thank you so much.
Thank you. Absolutely, appreciate it.
You good? You good? Okay. Thank you. Let me
Come visit.
I will.
Yes, absolutely. Come visit us. Come to the health fair.
Yeah, definitely be